who had intended to join me today was unable to return from Springfield time. So I'm standing in. And just, I think it's important to know, it's a large document. I don't know how much time you get to review it. The request for information provided by the Department of Human Services released last week essentially lays out, you can break it into two parts. One is ideas to prevent hospitalization, prevent the need for hospitalization. And the other part is buying private hospital beds to replace inpatient admissions at Tinley Park. So to take the first part first, as was said earlier, for the department to fund programs to prevent the need for hospitalization is laudable, but there are a number of concerns. One is that this is being launched at a time of $59.1 million in budget cuts for mental health services for the exact same folks that are to be addressed in the prevention plan. So my concern is that the department is taking away with one hand, not because they want to, but because that's the governor's budget proposal, while they give with the other. And in the end, what will be in place to serve individuals who are uninsured with mental illness may be the exact same thing or less. So how effective prevention can be at a time of tremendous budget scarcity is a real question. And that leaves aside what we've heard so far as well about the capacity of mental health agencies to provide these services. So then the other part of the plan, to buy private hospital beds to replace Tinley Park. There are a number of concerns as well. First, it's based upon the idea that a smaller number of beds will be needed because that prevention plan is supposed to work. But it may not, because the funding may well be inadequate. It also provides for a significantly shorter length of stay. The average length of stay at Tinley is 12 days. This will only pay for an average length of stay of 6 days, which means fewer services, quicker discharges, less discharge planning, less observation of medications before patients are discharged. There's some significant reductions in service that are part of that plan. And what we just learned from Dr. Ferguson is these beds may not be in the South End. And the whole concept of the initial stakeholders group from 8 years ago, when the state first attempted to close Tinley, when we met not once or twice, as the committees listed in this proposal have met, but when we met over the course of several months and discussed what does the Southland need, what was articulated was the Southland needs a safety net hospital in the South. That is not in this proposal. I also, and it's a little hard to discern, in the copy of the RFI I have from the DHS website on page 40, it's not a list of individuals who participated, it's a list of email addresses. So it's hard to tell, and I think Representative Jones was referring to this earlier, it's kind of hard to tell who was part of this. But when I'm looking, I'm not seeing a couple Will County hospitals that in the past have said they're uninterested in a CHIPS process with DHS. They think Tinley does this work very well, and they want them to continue to do the work. So it's very hard for me to tell that everybody was at the table. I mean, there are unions not. And I'm worried that, and this I think is the biggest issue for you guys, we know a budget is going to be voted on likely by the end of May. As has been noted, DHS has set out a very aggressive timetable for getting this all done. And they've already slipped, right? The proposals were due the 16th, now they're due the 20th. And Dr. Ferguson, who I have a great deal of respect for, indicated that she's fairly confident, and that ideally the proposals will be reviewed by the end of April. But is there really going to be a system in place to replace those extremely important services at Tinley Park Mental Health Center by the time you're expected to approve a budget that zero funds Tinley beginning July 1? I think that is the overriding concern. As you've heard, these services are so critical. We would ask you to oppose this closure because there is not